Hi, my name is Dr. Robin Abramczyk, and I'm a general dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and one of the procedures that we do here every day is called a frenectomy. And today I just wanted to share with you about the post exercises that we recommend doing, and we prefer that parents start those before the procedure, before coming to see us. And after the procedure, we recommend that we start those that evening around dinner time. And then on the second day, you'll start doing those 6 times a day for 3 weeks, and then 5 times a day for a week, 4 times a day for a week, and so forth and so on. So that's very important so that the raw edges of the wound do not close. We want the cells to fill across and granulate across the surgical site. And that's very important that we do that again with a frequency that we recommend, along with working with your IBCLC and the bodyworker. So those 3 things are important: working with your IBCLC, bodyworker, and doing the exercises. So I have Brittany here, and she's the frenectomy coordinator. I'll show you the exercises that we recommend. So underneath the lip, what you'll do is you'll go up into the vestibule. You just kind of go up all the way to the top gently, and you'll hold it for 1 1,000, 2 1,000, 3 1,000, and then you're just going to wiggle back and forth. Again, we don't want the wound to close, so we want to just dilate the area. Sometimes there'll be a little bit of oozing, and that's normal, but it does not require force. It's just dilating that wound and keeping it open. And then if the buccal frenula, the little attachments on the side, were released, you can just do a gentle sweep like this, and that's sufficient. Underneath the tongue, you'll get underneath the tongue, and I recommend having the baby's head toward the mom's hips. And then you'll just go all the way to the depth of the fold where the triangle will form. And you're just going to hold pressure for 1 1,000, 2 1,000, 3 1,000, and then you'll go up and down. Again, dilating the wound, keeping it open so that it doesn't close. And that's sufficient there. Another thing that we recommend is going all the way back to the hamular notch, and then you're just going to kind of hug along the cheek and cross that philtrum. This is the philtrum here, and you're going to cross the midline, cross the philtrum. You can just do that a few times on each side. 3 times on the right and 3 times on the left. And you're just going to be pulling that muscle, pulling it across. There we go. And then you can massage the TMJ area. I would be doing this with both hands on baby like this, and just massaging the TMJ and the muscles and just bringing everything forward. And then you can do extraorally. You can just do little circles. A lot of times the baby will track whenever you do that. Just doing little circles around. And then you can smooch the cheeks and just smooch the cheeks. Again, do it one more time. And then you want to open and just stimulate. This would be the alveolus or the bone on the baby. And so what happens whenever you stimulate this area, they should lateralize their tongue and then lateralize their tongue. And then you can just do this back and forth and just kind of play with the baby, have them do that. And then you want to just do some suck training. So I just like have the baby suck, and you can have them form an organized suck for about 30 seconds. And then if you want, you can do a little tug of war and just do a little tug of war with baby. And then lift up for me and head back. And then you want to go to the back of the palate and just gently do a zigzag. This will desensitize the palate. You'll oftentimes stimulate a gag reflex, but you just want to gently press out on the bone on either side. And then you can go along the tongue and just hop down or just stroke down like this. Just stroke down the tongue. And then you can do walking up the digastric. So what that would mean, underneath the chin here is the digastric. So you can just kind of walk along the digastric and just soften the submandibular area here. And then you'll go into the floor of the mouth, right behind where the teeth would be, but it'll be bone here called the alveolus, and you'll just press down and you'll go toward the midline. You'll just gently press right behind the alveolus toward the midline on either side. And just gently just press toward the midline. Then you want to take your pinky preferably, and you're going to go on the inside here and just press down into the floor of the mouth, and that will help to pop that tongue up. And again, you're going to be pressing toward the midline. Again, I'm going to go back here and press toward the midline, or all the way straight down. Straight down. Okay, then another thing you'll do is press here toward the pterygoids. Have baby will just gum down on that and gum down. And I can feel them, Brittany. It's super, super tight. This feels good on adults after a dental procedure. We love releasing the pterygoids. Internal, just do some pressure back there. It's oftentimes really, really tight, even on adults. And you're just going to have some pressure there. All right, so that's that. And then this is just an introduction to little Judah. We wanted to do the exercises on him, but he wasn't having that today. He had a tongue and lip tie, and we did his release when he was 2 weeks old, and he is a nursing champ now. So say hi, Judah. Okay, thank you so much for joining us, and please call us if you have any questions.